Hi, and welcome to the informational video series on the rules for certified family. This is video number 6, and we will cover behavior and guidance, prohibited discipline and actions, physical restraint, home capacity, home structure and safety, water supply and plumbing, prevention and management of hazards, maintenance and sanitation, and hand washing. My name is Jackie Barrios. I work for the Child Care Licensing Division as a Senior Licensing Specialist in the Salem Field Unit. The Child Care Licensing Division hopes that you find these videos informative and supportive in learning about the new Certified Family Rule Set. During each video in the series, we will explain some of the key features and highlights of the Certified Family Rules. Another new aspect is that the rules have been organized differently to help make information easier to find. While we are highlighting many key features, changes, and new rules throughout this video series, the entire rule set will not be reviewed. Please refer to the Certified Family Rulebook for the full list of requirements and rules. Okay, let's get started. We will start by reviewing an important update regarding behavior and guidance policies in family child care settings. These changes emphasize positive guidance and ensuring fair treatment for all children. You must use positive guidance techniques to help children develop self-regulation, self-direction, and respect for others. Some approaches include setting and teaching simple, clear, and positive rules that children can understand, creating an engaging environment that encourages positive behavior and self-regulation, and reinforcing positive behaviors through encouragement and descriptive praise. You must also actively intervene to stop the unfair treatment of children based on their family, gender, race, ethnicity, economic status, ability, religion, or cultural background. This includes redirecting inappropriate conversations or behaviors and being aware of and responding to the unfair treatment of others. These updates reinforce the importance of creating a nurturing, respectful, and equitable environment for all children. Let's go over some important updates regarding prohibited discipline and actions in family child care settings. These actions are now more clearly defined to ensure that all discipline methods are safe, respectful, and developmentally appropriate. The new rules explicitly prohibit certain actions that are harmful or inappropriate for children. These include using food or foreign objects in a child's mouth as a form of discipline, exposing children to extreme temperatures, whether hot or cold, as a form of punishment, humiliation or name-calling, including the use of derogatory or sarcastic remarks that could damage a child's self-esteem, excessive physical exercise as a punishment, which could be harmful or unsafe for children, requiring a child to remain silent or inactive for extended periods, which is inappropriate for their development. Removal from all activities as a disciplinary action, which can lead to isolation and emotional distress. These actions are prohibited because they can cause physical harm, emotional distress, or hinder a child's development. Instead, you are encouraged to use positive discipline strategies that focus on teaching, guiding, and helping children understand appropriate behavior. By following these updated guidelines, we create a supportive and safe environment where children feel respected and valued. We will now go over updates around the use of physical restraint for family child care providers. These changes emphasize safety, appropriate use, and documentation when restraint is necessary. Physical restraint does not include holding a child to comfort the child when in distress, or to move them safely from one area to another without the use of force, or assisting a child to complete a task if the child does not resist the physical contact. For example, helping a child to tie their shoe or hold a pencil. A provider may only use physical restraint if a child's safety or the safety of others is threatened and the provider has already followed all behavior and guidance strategies outlined in rule. If restraint is used, it must be as gentle as possible while still ensuring safety, limited to the shortest time necessary to regain control of the situation, and be developmentally appropriate for the child. Providers must not use bonds, ties, blankets, straps, or weights, and must stop using restraint if they feel a loss of self-control or concern for the child's well-being. If physical restraint is used, providers must report the incident according to rules, assess the situation to ensure the restraint was appropriate, and document the incident in the child's file, including the date, time, and duration, the caregivers involved, and the details of what happened before, during, and after the restraint. If restraint is used more than once on a specific child, a written plan must be developed with input from professionals familiar with the child, and you must notify Child Care Licensing Division when the plan is created. Child Care Licensing Division has created a document to help providers understand this new set of rules a little better. Feel free to ask your licensing specialist for a copy of PTA 0662. These changes ensure that physical restraint is only used as a last resort, is done safely, and is monitored for appropriate use. Let's discuss an update to the Certified Family Child Care rules regarding toilet requirements and capacity limits. The requirement for a second toilet has been removed for certified family homes, and you can now operate with one toilet and have a maximum capacity of 16 children, as long as all other licensing requirements, like having enough square footage, are met. This makes it more accessible for you to operate without needing an additional restroom. You must still meet all other health, safety, and supervision regulations to accommodate up to 16 children. This change offers more flexibility for providers while ensuring child care homes remain safe, functional, and compliant. Our next update are rules related to building and safety requirements for certified family child care homes to ensure a safe and secure environment for children, as well as ensuring safe evacuation routes in case of emergencies. A certified family child care home must be a building constructed as a single-family dwelling or other suitable dwelling to provide a safe residential setting for children. All floor levels used for play or napping must have 2 usable exits leading to the ground level, and rooms used for play or napping must also have 2 usable exits to ensure safe evacuation in emergencies. You must also ensure that children cannot access hazardous heating equipment such as furnaces, fireplaces, stoves, steam pipes, hot water pipes, and space heaters. Also, when indoor temperatures drop below 68 degrees or rise above 85 degrees, providers must implement strategies to help children stay warm or cool. And finally, indoor platforms or lofts over 30 inches high must have protective barriers to prevent falls. These updates enhance child safety, emergency preparedness, and environmental security in certified family child care homes. Let's go over the updated rules regarding private wells in family child care settings. If your family child care home uses a private well for water, there is an updated requirement for testing before you can receive your initial license, and at a minimum every 2 years after initial testing. This ensures that the water used in the child care home is safe for drinking, cooking, and cleaning, protecting both children and staff from potential waterborne contaminants. The testing should cover important factors like the presence of harmful bacteria, nitrates, and other potentially hazardous substances. It's crucial to follow the required testing schedule and keep documentation of the results. If the water does not meet safety standards, corrective action must be taken to ensure safe water is provided. Completing these tests and maintaining documentation ensures that the water in your child care home remains safe and compliant with health standards, contributing to a healthy environment for everyone. Now, let's discuss the updated rules for preventing access and exposure to toxic substances and required barriers around bodies of water. The updated rules clarify that any hazards, including sanitizing and disinfecting solutions, must be inaccessible to children. This includes ensuring that chemicals, cleaning agents, or other potentially harmful substances are stored in secure locations where children cannot reach them. Inaccessible storage is key to preventing accidental poisoning or injury. Additional examples of hazards include lead-based paint, plumbing or fixtures with lead, asbestos, and toxic mold. Access to these substances could pose serious health risks, and child care homes must take steps to eliminate or prevent exposure to these toxins. Also, these rules require that access to pools, ponds, and hot tubs be prevented with the use of appropriate barriers. These bodies of water are significant safety hazards, and it is crucial that they are securely fenced or otherwise blocked off to prevent children from accessing them. By ensuring that these hazards are properly stored and preventing access to dangerous areas like pools and ponds, you are creating a safer environment for the children in your care. Next, we will review updates to waste management and sanitation protocols for family child care providers. These changes ensure a clean, safe, and hygienic environment for both children and caregivers. All garbage and bodily fluids waste must be kept in non-absorbent, easily washable containers with tight-fitting lids to prevent contamination and odors. Items such as paper towels that do not create offensive odors can be disposed of separately in an uncovered container inside the home. You must have a clear procedure for the immediate cleanup of any bodily fluid spills, such as urine, feces, blood, or vomit. The cleanup process must be thorough and include disinfecting the infected areas to prevent the spread of germs and ensure the health and safety of everyone in the child care home. By following these guidelines, you are maintaining a hygienic environment that promotes the health and well-being of the children in your care, preventing the spread of illness and ensuring a safe, comfortable place to rest. Next, let's go over a new update related to hand washing for children who may not be able to wash their own hands independently. For children who are not yet able to wash their own hands, you have the option to use a single-use cloth to wash the children's hands rather than requiring hand washing under running water. This provides a practical solution for younger children or those with physical limitations who cannot manage traditional hand washing on their own. The use of a single-use cloth helps ensure that hygiene is maintained without requiring water access for every child. After use, the cloth should be disposed of or washed thoroughly to maintain sanitary conditions. This update helps promote effective hand hygiene while considering the abilities of the children in your care, especially when they are not yet able to wash their hands independently. Thank you for watching this video in our informational video series. You can now move on to the next video in this series. If you have any questions, please contact your licensing specialist. For more information, you can visit our website at www.oregon.gov/DELP.